Good almost afternoon, everyone. Thanks for joining us today for the Innovation, Patient Focus, and Care Improvement Veterans Administration Leadership in Kidney Care. I'm Ed Hickey, CAPS fan, AAKP board member, and chair of AAKP's Veterans Health Initiative. This initiative is based within the AAKP Center for Patient Engagement and Advocacy, and is designed to advance research, innovation, and policies aimed at safeguarding the highest standards in kidney care and treatment for veterans managing kidney disease both inside and outside the VA medical system. As a veteran myself and coming from a military family and having all of my sons in the military, this is a population and issue that is very important to me. On behalf of AAKP, I'm honored to have the following guests speak with us today. Dr. Prabir Roy Chaudhry is a graduate from the Armed Forces Medical College. He's currently a professor of medicine at the University of Arizona Health Science. Dr. Roy is also the director of the Division of Nephrology and the director of the Arizona Kidney and Vascular Center at the University of Arizona College of Medicine in Tucson. He is currently conducting research funded by the National Institute of Health and the Veterans Administration. And to his right is Mr. Durante Briggs, an AAKP ambassador for the Washington, D.C. area. Durante is a highly decorated, honorably discharged Desert Storm, Desert Shield veteran, kidney recipient, and founder and CEO of the Veterans Transplantation Association. I'm pleased to welcome Dr. Roy to get us started.
Thank you very much for that kind introduction, and it really is a pleasure to be here. As Mr. Hickey mentioned, I trained outside of the U.S., but I did train in a military medical college, and a large number of my classmates actually are in a military system in India. I've also been a VA physician pretty much for my entire professional career in this country, and that goes all the way from being a nephrologist at the VA, but to also moonlighting at times in the VA emergency room. And it's actually, for me, has been one of the most important learning experiences, both professionally and in terms of patient interactions, in terms of what I have done at the VA. So having said that, what I thought I could do, and this is really just to set the stage for what I hope will be a robust discussion, is just to go through a little bit about kidney care in the VA. And I'm going to try and focus on two main aspects of kidney care in the VA. The first is about the fact that I really do believe that there is a very nice integrated system of kidney care within the VA system, and I think Dr. Fadem mentioned this at an earlier session. But then I also just want to spend a little bit of time talking about something that perhaps we don't often associate that much with the VA, which is about research and innovation within the veterans system. So let's talk about integrated kidney care initially. The VA really runs the largest integrated healthcare system in the United States. So this is not just kidney care, but it's the entire VA health system. It provides care to over 9 million veterans, and it does this through a system of 170 medical centers and over 1,000 outpatient medical centers. When you're talking about kidney care within the VA system, the one point that I really want to emphasize again is that this truly is an integrated, full-service, one-stop shop kidney care program. It goes all the way from general nephrology and glomerulonephritis to chronic kidney disease, to dialysis, to transplant. And I think very importantly, and this is from personal experience, it's a patient-centered mode of care. And I think one of the things that brings out this patient-centeredness in my mind, again, more than anything else, is that there's this absolutely wonderful set of educational resources and tools that the VA has developed called the eKidney Clinic, and that's shown on the right side, and it's got this huge amount, a wealth of information really about general kidney disease and nutrition and lab tests and social work services and pharmacy benefits and treatments. And regardless of whether you're in the VA system or not, I think this is just an absolutely huge resource. Kidney care within the VA system is provided across almost 150 different VA facilities. The large majority of these facilities actually offer dialysis services, and of course the VA also pays for dialysis services for veterans in non-VA facilities. There are a number of firsts, though, that I think we often forget about. The VA was absolutely the first national healthcare system in the US to offer maintenance dialysis, and this goes all the way back to the early days of dialysis. And then in 2001, the first guidelines on chronic kidney disease in the US, the clinical practice guidelines, actually came out of the VA system. We have lots of guidelines right now, but the VA was really at the forefront in getting the first of these out. We had some discussion about transplantation earlier, and again, there are 7 kidney transplant centers within the VA that perform kidney transplants. As we mentioned earlier, there are about 11 transplant centers as a whole. Payment for immunosuppression is something obviously that's really topical. The VA provides immunosuppression free for life. Travel costs pretty much across the board are paid for. What does happen in the VA system for transplantation, and I'm a transplant nephrologist, is that the home VA center does a lot of the initial workup and then sends that information to the transplant VA center, and there are very clear timelines that are laid down, and that's actually refreshing when thinking about my non-VA work, that the VA transplant center has to get back to the home center and the patient within a specific period of time. And we're not talking about 6 months. There's a 1-week cutoff at one point and then a 30-day cutoff for another issue. And then once you get the transplant at the VA transplant center, transplant follow-up then is a partnership between the home VA and the transplant center, and I'm sure Durante is going to speak a little bit more about that. In this second part of this very brief setup presentation, I really want to speak about research and innovation, because I don't think we think about the VA that much when we think about research and innovation. I personally have been funded by the VA through the VA Merit Research Program for over 12 years now, and I think our group has done a lot of useful work, as have many other academic groups. The focus, obviously, in the VA Research Program is on diseases and conditions that impact on veterans. VA centers across the country have close links with academic centers, and I think this is a huge plus, because this really allows for a vibrant research program within the VA, and I think talented individuals, physicians, other ancillary staff actually being at the VA, also having some roles in the academic medical center that's linked to the VA. The VA spent almost $20 million last year on kidney research within the VA system, and there is actually a wonderful program called the VA Cooperative Studies Program that has supported major clinical trials in the kidney disease area and also in other areas of medicine. One of the things that, again, I think very few people know about is that there's actually a VA Center for Innovation. And the goal of the center is to identify, test, and evaluate new approaches to address important healthcare issues within the VA system. And in the specific area of kidney diseases, there are 4 projects that have come out from this VA Center for Innovation. So one of them was the eKidney clinic education portfolio that I spoke about in one of my first slides. And again, I think that potentially could have huge impact. There's a project on the use of telemedicine for kidney patients. There's a project based out of the University of Michigan at Ann Arbor that focuses on the development of a CKD renal information system. And again, this is critically important, and Dr. Starr obviously spoke a little bit about this from the NIH standpoint. And then there's also a project on a wearable artificial kidney system for recycling peritoneal dialysis. And again, I think the message that comes out when you look at these 4 different innovation projects is that they're all very, very patient-centered. The VA also has an innovators network, and this is present in about 33 VA medical centers. And what the innovators network is, that it's really a safe space within the VA system for VA employees to test out new ideas. And a lot of these ideas, not unexpectedly, can be in the area of process of care innovation. How do you improve the workflow? How do you use technology to make things easier and better, both for patients and for the healthcare professionals that look after them? And one of the slogans, perhaps, if you will, within the Innovators Network is test small, fail small, but then scale big. And that's one of the things that the VA really can do. It can take innovation from within the VA system or from outside, and it can scale it up across the entire VA system. And in my mind, at least, the presence of this innovation substrate, if you will, within the VA, I think could really make it an ideal setting to test out some of the new therapies that I really hope, that we all hope, will be coming out from programs such as the Precision Medicine Initiative that Dr. Starr spoke about, and coming out from the Kidney X, or the Kidney Innovation Accelerator, that Sandeep Patel spoke about yesterday. So finally, to end my very brief overview of kidney care within the VA system, I think it's comprehensive, and not just clinically, but also geographically. I think it's integrated. I think there's a focus on process of care innovation, and I think it is very patient-centered. We can all do better, but again, my experience, again, within the VA has really been extremely positive, and I think it's really important for all of us also to recognize the research and innovation focus that is also present within the VA. And with that, I'm going to call upon Durante to make some comments. Thank you very much for your attention.
Well, good evening. Good afternoon. How's everybody doing? All right, well, my journey dealing with kidney disease started in 1992 when I initially got out of the military at Fort Dix, New Jersey. I was advised that my kidneys were spilling protein in 1992. So going through the process over the years, I started going to the VA hospital, which I started at the Hampton VA Hospital. And by being at the Hampton VA Hospital, they basically, monitored my kidney disease over the years. And it took from 1992 all the way up until 2008 when I ended up with end-stage renal disease. And at that time, that's when I had to start dialysis at the Hampton VA Hospital. At beginning dialysis, they took good care of me at the VA hospital in Hampton, Virginia. I really never had any issues or any problems while I was there. But the biggest thing, being a veteran and, being in a Gulf War, fighting for our country, that's when I realized that when they told me, you got to start dialysis, I never expected I had to start on dialysis. But after receiving the treatment, then I realized I had to be positive. I had to motivate myself through the entire process because I wanted other veterans that was on dialysis, that was depressed, that, hey, I want to be able to do something for them. So I transferred from Hampton VA Hospital to Washington, D.C. Veteran Hospital in 2010. And believe it or not, it was the best move that I ever made because by going to the Washington, D.C. Veteran Hospital, that's when I learned about a program that Walter Reed Medical Center was having for combat veterans. And with me being a combat veteran, being in Desert Storm, Desert Shield, it allowed me to be eligible for the, to get on the transplant list at Walter Reed. So after the workup, a year and a half, I received my kidney transplant. My last day of dialysis was October the 23rd of 2012. When I woke up the following morning, October the 24th, I had my new kidney, my second chance at life. Her name was Amber. Amber sits right here. I tell everybody, that's my other woman, so you can't get mad at me. She gonna be with me for the rest of my life. But the care that I received was excellent. I received good care. And one thing I realized that my surgeon, my last visit with him at Walter Reed, he said, Mr. Briggs, we did not give you that kidney to sit in a rocking chair. We gave you that kidney to get out in the community, be an advocate, enlighten the veterans about the opportunities that they can receive by knowing about, hey, there's a program at Walter Reed. If they're serving in combat, they can be placed on the transplant list there. So ever since then, October, when I got out of the hospital, October the 27th, immediately I started volunteering, advocating, going to the VA hospitals, going back trying to educate those veterans that's sitting on the dialysis machine, that were sleeping. I had to wake their mindset to wake them up, hey, let them know exactly the things that's going on. So I joined many organizations. I joined Team Maryland, which is a transplant team of veterans, not only veterans, but anybody that received any form of kidney transplant or any form of transplant, where we're an Olympic-style team, where we go out into the community throughout the states, at least every other year, competing in Olympic-style games. I attended 2 transplant games. The first transplant game was in Houston, Texas. It was hot. You got transplant recipients out there in 110 degrees heat. We running around sweating, muscle cramps, but we all made it, we survived. But what I was looking for was representation for veterans. I saw no representation for veterans. So in 2016, I went to Cleveland, Ohio. It was still no representation for veterans. So that's when, I said to myself and to one of my team members that I wanted to do something for the veterans. I want veterans to be recognized, to understand the importance of what they're dealing with kidney disease. So that's when the idea of Veterans Transplantation Foundation was founded. And with Veteran Transplantation Association, it is an organization, a nonprofit, that basically, I wanted to give back to those veterans the things that I did not receive when I was on dialysis, at the VA hospital, not being able to, you sit there, your mind is idle if you don't have anybody to come around and talk to you. We know that, the nephrologists, the social workers, they can't get around to talk to everybody. So by me forming Veterans Transplantation Association, basically, we're in the process of working on a peer support specialist training group. And this will allow a person being trained, a veteran, already gone through the process, where we can go through the VA hospitals and enlighten those veterans and talk to them and let them know about their benefits. Because believe it or not, so many veterans, they don't know about their benefits. So that's one of the key goals as far as with VTA, where we like to get out there and educate those veterans. Another thing about VTA, we involve in community activities where we do things for the community. We go out to the VA hospital, we give them gift bags to let them know, hey, we care for you. We want you to know that, we're out here, there's somebody out here that care for you, and we want to be able to touch you and educate them and let them know that, hey, you are loved. So with Veteran Transportation Association, the members is open to everybody, to veterans, their spouses, where we want to be able to just motivate those individuals about the importance of everything that they're dealing with from the beginning process, before kidney transplant, all the way through post-transplant. So we can be able to be with them from the beginning. But like I was saying, I never experienced any problems with the VA hospital during my whole entire time. You know, they took good care of me, but the most important thing is, as a veteran, we have to know about our own benefits. We have to know that the system is there for us, but you have to be able to have that knowledge to be able to navigate your way through the system. So that's why VTA want to be there, to help those individuals, to help guide them and give them that knowledge and share that wisdom with them so they can understand exactly what's going on as far as with their benefits and going through the kidney process. And because we know a lot of people on dialysis, you know, all you do is sleep. You get on the machine, you just want to go to sleep. But we just want to wake them up. So, you know, trying to start some pilot programs where we may try to do certain things to see if we can get tablets for those veterans that's on dialysis so that we can waken up their minds so that they can learn more about what's going on with them as far as the kidney process. And one thing when it comes to the veteran benefits, I tell all the veterans, anytime you need to know anything about your veteran benefits, all you need to do is just go to look up the Title 38, which is the law for the United States Code, Title 38, which deals with all veteran benefits, entire benefits dealing with veterans. And one thing, you know, I love being a part of this organization, you know, being the CEO and being the founder, because I want to be able to touch the lives of those individuals that need their help, and so that I can continue to live my legacy, to leave a legacy for other people that I know, and just make a difference. That's what's important, sharing that knowledge. No need to hold that knowledge in. Need to share it so they can understand the whole entire process. And that's all I have right at this moment.
So we'll open it up for questions here, if anyone has any questions. And here's
Dante, like I told you yesterday,
Yes.
I'm your woman for Pittsburgh. I myself am a veteran, Navy retired. Let's go Pens. The Eagles and the Caps have to win one game in 50 years.
They also won the cup. So.
Yeah, but in 50 years, one. Okay.
I'll take it.
I'm one of those people that don't know all my benefits. And I am surrounded by people at my dialysis center that can't get into the VA dialysis center. And there is no, I was just talking to one of the Vietnam vets the other day. There is no, the social worker at the dialysis center can't get any information from the VA hospital to help this gentleman. And he's getting really, really super frustrated with it. And I think those are the kind of things that we can help people with.
Right, absolutely.
Because we're together. I mean, we did this for all of you. We're here because all of you trusted us with your lives, really. I never got to serve anywhere except for Okinawa, Japan, when you were in the desert. I was in Okinawa. They were worried about Korea, so I had to stay there. My husband was with First Marine Recon, and during his first tour in Okinawa. So both of us have gotten our disease from our service. He has been able to get all his benefits. He's 100% disabled plus. Myself, can't get through to anybody to get anything. The other thing I'd like to suggest, if you're a veteran and you have any kind of disability, move to Pennsylvania. Pennsylvania, the state of Pennsylvania has more benefits for veterans, especially if they're 100% disabled, than any other state in the union, including no property tax. No car registration payments, those kind of things. So those are the kind of things that most people don't know about, right, that we can help them with.
Yes. Well, thank you. And good luck next week.
But you know, you're absolutely right. When it comes to, you know, we have to be able to educate those other veterans about their benefits. And if you know the law, like I said, Title 38, you read the law, if it's not in black and white, it don't exist. And Title 38 is in black and white. It does exist. And that's how you're going to get your benefits, by knowing Title 38. And one thing with VTA, we're basically going to help those individuals to guide them through the process to know about Title 38, to help them receive their benefits and guide them and direct them in the right area. And one thing, in the state of Maryland, they have pretty good benefits for veterans. No property taxes at all. Now, no free registration. I still got to pay $22 for my tags, but hey, it's $78 for my registration. Yes. Yeah, but
Plus we get more Lombardies.
but that's okay. But I'm a Pittsburgh still a diehard fan, so hey.
Well, sorry you'll have to leave so early. But
Yes, but it's, like I said, it's very important that we all veterans have to come together, because believe it or not, you have some veterans, they know what can be done for another veteran to get their benefits, but they just don't want to say anything. They just sit back, because no veteran should suffer. We served our country, so we got to help each other, pick each other up to make a difference.
come on, sure, come on up.
Unfortunately, your system will not work in this country, because the rest of the healthcare system is profit motive. It's not a closed system, and this kind of efficient coordination will not be there by the very nature of the healthcare system in this country. It's unfortunate. Thank you.
You mean the VA system itself?
VA system is so efficient because you are a closed system.
Right.
No profit motive,
Mm-hmm.
and everybody who is eligible for that goes through the same method of acquiring the health care, but outside of that, this model will not work.
Right. I mean, clearly, there are significant financial revenue generation and profit differences between the overall healthcare system and the VA system. But I would argue that as all of us, and I think everybody in this country is concerned about healthcare, even though people have different views, I think we need to be looking at the VA system as an example of what can be done, I would say particularly in the primary care area and in the area of being able to integrate services. And while everything that is done within the VA system, clearly, you know, it's going to be difficult to transfer that outside the VA system, but I think that there are many important lessons that healthcare outside the VA can learn from the VA and hopefully implement some of those at least within the larger healthcare system. So I would be more optimistic. I don't know about the...
My wife retired a year ago, and we lost her insurance from J.P. Morgan. So I got on the Medicare supplement plan, which is great, but I had no prescription coverage. My immunosuppressants going through Medicare is like $400 deductible and on and on. So what I did is I called the VA, and I got on the VA system. I get my meds now through the VA in Phoenix. And everything has been going tremendous. I saw the nephrologist in Phoenix, and great coverage, great. And she retired, and so they have two nephrologists in Phoenix now, and they're not taking any new customers. So now they referred me to this open choice program. I see my regular nephrologist, and That way, my regular nephrologist can send in the prescriptions. But my prescriptions for my transplant meds are $24 for a 90-day supply, which is not a bad deal. But if I was a service-connected disability, it would be no charge. So I just want to let you know that I had no problems. Things are going good with the VA with me.
Yeah,
So.
and I think one of the other strengths within the VA system, having worked both in VA and non-VA settings, is that the VA has actually empowered pharmacists to play a very, very important role in the care of patients. So, you know, if I were a pharmacist, I would like to work at the VA because I think you have a much larger role, you have the opportunity to make an impact, and it's clearly critical, particularly for transplantation and kidney disease, is to be really on top of your medicines.
Any other questions?
And that's true as far as, you know, with your medication, because one thing, I'm 100% service connected. And, you know, there's no co-payments, even though I still have Medicare. But one thing I love about the pharmacies dealing with at the VA hospital, I can go right on, log on to my account for my MyHealthyVet. And on MyHealthyVet, go to my medications, medication list, whatever I need to refill, click. Within 2 days, I have my medication. Within 2 days. And one of the most important things I tell all the veterans, make sure you never run out of your medications. When you get down to at least about 20 days out before running out, go ahead and submit your refill request. And the VA, the pharmacy is good about making sure you receive your medication prior to you running out.
That's great. Anything else, Doctor?
Yeah. I was going to put it to the panel. I mean, you know, I think this partnership between an organization like AAKP and the VA, I think really has huge potential to be able to make an impact. And I would be interested, Durante, in your thoughts or others about what the vision is going forward for this partnership.
Go ahead.
Well, one thing that I feel like that it would be a great opportunity for Veterans Transplantation Association to partner with AAKP because of the fact that with the kidney community, being able to put the education out there for those veterans and their spouses to let them know that, hey, you got a powerful kidney organization out here. It's nonprofit. It don't cost you anything to be a member, where they give you all the materials that you need. And that way, the veterans, I can bring the veterans where we all can come together.
And we've started the Veterans Health Initiative, working directly with the VA and coordinating our efforts and talking to them about what they'd like to see. We're working through the veteran service organizations with the legislative aspect, but also the policy aspects. We're very active there. So it's a growing program. We just kicked it off about a month ago. So your question is very timely.
Good. Excellent.
Yeah, anyone else? No? Well, thank you, Dr. Roy and Devontae, for joining us today. Excellent presentation. We look forward to seeing everyone at lunch. It's on the mezzanine at 12:30. It's Eat Lunch with the Experts, and I believe you have tickets in your envelopes that you received when you checked in. So we'll see everybody there. Thank you.
Great. Thank you.